I'm glad somebody asked about that, because postpartum depression is common. In fact, there's something called perinatal mood disorders, which has postpartum depression, psychosis, and also some other, depression as well. And a lot of women go through that without knowing. It's perfectly okay the first 6 months to feel sleep deprived, you're not sure, you're not eating because you're so busy with this new baby. But beyond the 6 weeks, if this goes on, it is not normal and something needs to be done about it. A lot of us will normalize the symptoms because one, maybe we're so used to being type A, which I'm one of them. I have control of everything. But then you have a baby who is not sleeping. You can't eat. You can't wear your makeup. You can't do anything. So you're constantly around the baby. You're not sure. So sometimes you get this depression because you resent not having control. You can't eat. You're not sleeping. You're not focusing. You're crying. So what's supposed to be a joyful thing makes you sad. So those are signs of postpartum depression, and you cannot pretend that it doesn't happen. There are risk factors like you're asking. One is your first baby, you don't know what to expect. You're used to controlling your own environment. You have a history of anxiety or depression before the pregnancy. You've gone through stressful time during the pregnancy, like hyperemesis we talked about. You have maybe problems with your partner, maybe work, you don't feel supported. And then when you come in labor, things just not the way they were supposed to be. You just lost the control. Then afterwards, after the baby is born, things that you've never read about. Nobody has told you about these things. So rather than think that these things are normal, you need to report it. So the best thing is to reach out to a healthcare provider immediately and to be able to share those things. And we sometimes see it in the office, because by the time you ask somebody, how's the baby, and they start to cry and you see those tears rolling, then you have to take a step back and begin to dig into some of those things that may be causing the depression. It's common and it just needs help.